Every 30 seconds, someone somewhere in the world loses their life to liver cancer, a disease that often develops quietly and without clear warning. It is commonly described as a silent killer because the earliest signs are so subtle that most people barely notice them. Persistent tiredness, mild abdominal swelling, or a small shift in appetite are often ignored, yet these seemingly harmless changes can be the first signals of a deadly illness. In the most recent global estimates, more than 1 million people are diagnosed with liver cancer each year, and the majority of cases are still detected at advanced stages when treatment options are far more limited and less effective. The liver itself contains no pain receptors, allowing damage to progress silently for months or even years, while cancer continues to grow unnoticed. When clearer symptoms such as yellowing of the eyes or skin, rapid weight loss, or ongoing discomfort finally appear, the disease has often already spread, leaving patients with very few choices. What is crucial to understand is this liver cancer can be treated when it is found early. The real challenge lies in recognizing the quiet warning signs before the disease reaches a critical point. So, what are the 15 symptoms that could signal your liver is under serious attack? Stay with me because in the next few minutes we will break them down one by one, and some of them may truly shock you. Important disclaimer. This video is intended for educational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider if you have any health concerns. All information presented is supported by scientific research with sources available in the video description. Now let us begin uncovering the hidden warning signs of liver cancer. 1. Frequent infections. Frequent infections can be an early and often overlooked warning sign of liver cancer. This disease is commonly connected to long-standing viral infections, such as hepatitis B and hepatitis C, which slowly erode the immune system over many years without causing obvious symptoms. As these chronic infections persist, the body becomes less capable of defending itself, leading to repeated bouts of illness. When liver function begins to fail, its critical roles in detoxifying the blood and regulating immune responses are significantly weakened, allowing bacteria and viruses to take hold more easily. Recent global analyses suggest that chronic hepatitis infections are involved in approximately 70% of liver cancer cases worldwide. Further research shows that people with advanced liver disease experience a high rate of secondary infections, with about 40% developing recurrent respiratory infections and nearly 30% suffering from urinary tract infections, both of which can severely reduce quality of life. Under normal conditions, the liver acts as a powerful biological filter, clearing harmful microorganisms from circulation. When cancer disrupts this process, the body loses an essential line of defense, enabling infections to spread faster and placing additional stress on an already weakened system. These repeated infections not only drain energy, but can also accelerate disease progression and interfere with treatment effectiveness. If frequent infections occur alongside symptoms such as yellowing of the skin or eyes, constant exhaustion, or unexplained weight loss, these signs should never be ignored. Early medical evaluation can make a critical difference improving outcomes and helping restore the body's ability to protect itself. 2. Jaundice. Jaundice is one of the clearest visible signals that the liver is under serious stress, and in some cases, it can point to liver cancer. One of the liver's essential jobs is to process bilirubin, a yellow compound, released when old red blood cells are broken down. In a healthy body, bilirubin is filtered from the blood, converted into bile, and safely eliminated through the digestive system. When a tumor develops in the liver, it can damage liver cells or block the bile ducts, preventing bilirubin from being properly cleared. As bilirubin builds up in the bloodstream, it begins to deposit in the skin and the whites of the eyes, causing the yellow discoloration known as jaundice. Recent clinical reviews indicate that roughly 25% to 45% of people with hepatocellular carcinoma, the most common type of liver cancer, develop jaundice at some stage of the disease. This symptom is often linked to tumor invasion of bile ducts or widespread liver damage that severely disrupts bile flow. Although jaundice can also result from conditions such as gallstones or viral hepatitis, it should never be dismissed, especially when it appears alongside persistent fatigue, unexplained weight loss, or abdominal discomfort. If yellowing of the skin or eyes is noticed, immediate medical evaluation is essential, as early identification can significantly improve treatment options and long-term outcomes. 3 pale or chalky stools. Changes in stool color can provide important clues about liver and bile duct health. Under normal circumstances, bile produced by the liver flows into the intestines and gives stool its typical brown color. When bile production decreases or its flow is blocked, stools may become pale clay-colored or chalky, signaling a potential problem. In cases of liver cancer, growing tumors can obstruct bile ducts or interfere with the liver's ability to produce bile, preventing it from reaching the digestive tract. Clinical observations from recent hepatology studies show that a significant number of liver cancer patients with bile duct involvement report light-colored stools, sometimes appearing weeks or even months before more obvious symptoms develop. These stool changes often occur together with itching, digestive discomfort, and jaundice, all pointing to impaired bile circulation. If stool consistently appears unusually pale or gray, it should not be ignored. This may indicate early liver dysfunction or bile duct blockage. Prompt medical assessment can lead to earlier diagnosis, timely treatment, and better overall outcomes. 4. Loss of appetite. A noticeable decline in appetite is often one of the earliest internal signals that something is wrong with the liver. Because the liver is deeply involved in digestion, nutrient processing, and energy regulation, the presence of cancer can quietly disrupt these systems long before more obvious symptoms appear. Liver tumors are known to release chemical signals that interfere with normal hunger regulation, causing early fullness, persistent nausea, or a general lack of interest in food. At the same time, cancer-related inflammation can further blunt appetite and interfere with how the body absorbs nutrients. Recent clinical data suggest that more than 1/3 of people with liver cancer experience a sustained loss of appetite prior to diagnosis. Researchers have also observed that early satiety and chronic nausea frequently lead to unintended weight loss, reduced muscle strength, and greater difficulty tolerating treatment. When appetite loss persists, it can quickly progress to malnutrition, weakening the immune system and limiting the body's ability to cope with disease. If reduced appetite continues for weeks, especially when combined with abdominal discomfort, unexplained fatigue, or yellowing of the skin or eyes, prompt medical evaluation is essential. Identifying the cause early can greatly improve treatment options and overall outcomes. 5. Dark urine. Urine that suddenly becomes unusually dark, resembling tea or cola in color, can be a subtle but important warning sign of liver cancer. This change often occurs when bilirubin builds up in the bloodstream due to impaired liver function or blockage of the bile ducts. As excess bilirubin is filtered out by the kidneys, it passes into the urine, causing a noticeable darkening even when fluid intake is adequate. Liver health organizations have noted that dark urine and light-colored stools may appear weeks before visible jaundice develops. Recent observational studies indicate that nearly half of patients with liver cancer show elevated bilirubin levels at the time of diagnosis, with urine darkening among the earliest reported symptoms linked to bile flow obstruction. While dehydration can also darken urine, the color typically returns to normal with proper hydration. If dark urine persists or is accompanied by fatigue, right-sided abdominal discomfort, or yellowing of the skin or eyes, it should not be ignored. Early medical assessment can help detect liver dysfunction sooner, significantly increasing the chances of effective treatment. 6. Swollen legs and ankles. Ongoing swelling in the legs or ankles is not always a simple circulation issue, and in some cases it can signal serious liver trouble, including liver cancer. This type of swelling, medically referred to as peripheral edema, develops when the liver can no longer manage fluid balance effectively. As liver tumors grow, They interfere with normal blood flow through the liver, increasing pressure within major blood vessels. This pressure pushes fluid out of the bloodstream, first causing fluid buildup in the abdomen and later settling in the lower legs and feet due to gravity. Clinical data indicate that a large proportion of people with advanced liver disease experience lower limb swelling as the disease progresses. Another contributing factor is portal hypertension, a condition marked by elevated pressure in the veins supplying the liver, which further promotes fluid retention in the legs and ankles. At the same time, a damaged liver may produce insufficient levels of albumin, a protein essential for keeping fluid inside blood vessels. When albumin levels drop, fluid easily leaks into surrounding tissues, making swelling more pronounced and persistent. Recent hepatology reports have shown that individuals with low albumin levels are significantly more likely to develop severe and chronic leg edema. If swelling in the legs or ankles appears without a clear cause or fails to improve, it should not be ignored. Early medical evaluation can uncover underlying liver problems and lead to more effective treatment. 7. Persistent fullness or bloating. A constant sensation of abdominal fullness or bloating, even after eating very little, can be an early but often overlooked sign of liver cancer. As tumors enlarge the liver, they can crowd nearby organs, creating pressure that leads to tightness, discomfort, and a lingering feeling of being overly full. This sensation is not always related to food intake and may persist throughout the day. Another major cause of bloating is ascites, a condition in which fluid accumulates within the abdominal cavity due to impaired liver function. When the liver loses its ability to regulate blood flow and fluid balance, excess fluid leaks into the abdomen, leading to visible swelling, digestive discomfort, and reduced mobility. Medical reviews suggest that more than half of patients with liver cancer eventually develop ascites, with many reporting bloating as one of the earliest warning signs. This fluid buildup can also suppress appetite and contribute to sudden changes in body weight. If abdominal swelling, ongoing bloating, or a constant sense of fullness develops without an obvious explanation, it should be taken seriously. Prompt medical assessment can help identify liver-related complications earlier, improve symptom control, and significantly enhance treatment outcomes. 8. Frequent hiccups. Hiccups are usually short-lived and harmless, but when they become persistent or uncontrollable, they may point to a deeper problem, including liver cancer. As a tumor enlarges the liver, it can begin pressing upward against the diaphragm, the muscle that controls breathing. This pressure can irritate the phrenic nerve, which sends signals to the diaphragm, triggering repeated involuntary spasms that result in ongoing hiccups. Clinical observations have shown that in rare but significant cases, persistent hiccups are linked to abdominal tumors that physically disrupt nearby nerves. Recent case reviews indicate that some patients with rapidly growing liver tumors experienced hiccups lasting several days to more than a week, caused by direct diaphragm compression. While occasional hiccups are a normal part of life, those that continue beyond 2 days or occur repeatedly without a clear reason should raise concern. When persistent hiccups appear together with symptoms such as abdominal pressure, yellowing of the skin or eyes, or unexplained weight loss, immediate medical evaluation is essential. Identifying the cause early can open the door to more effective treatment and better outcomes. 9. Itchy skin. Chronic itching that persists without an obvious cause can be more than a skin problem and may signal underlying liver dysfunction, including liver cancer. When tumors interfere with bile, flow bile acids are unable to drain properly and begin to accumulate in the bloodstream, a condition known as cholestasis. These substances can deposit in the skin, triggering intense persistent itching that often becomes worse at night and does not respond well to typical skin treatments. Recent biomedical studies have linked severe liver-related itching to elevated levels of enzymes involved in nerve signaling within the skin, which amplify the sensation of itch. Researchers have found that patients with bile flow obstruction frequently report widespread itching long before other visible symptoms appear. Although itchy skin alone does not confirm liver cancer, it should never be dismissed when combined with fatigue, jaundice, or unexplained weight loss. Seeking medical evaluation early can help uncover liver-related conditions sooner and significantly improve prognosis. 10. Back pain. Back pain is commonly blamed on aging posture or muscle strain, but in some cases, persistent or unexplained back pain may be linked to liver cancer. As liver tumors grow, they can press on surrounding tissues or nerves, causing pain that radiates to the back. The liver's close anatomical relationship with the diaphragm also plays a role, as irritation of this muscle can create referred pain that spreads to the right shoulder blade or lower back. Clinical case reports have documented situations in which liver cancer spread to nearby bones, or the spine, presenting initially as chronic back pain before more typical liver symptoms emerged. Recent oncology findings suggest that a small but significant number of liver cancer patients report ongoing back or shoulder pain early in the disease course. If back pain persists without a clear cause, especially when accompanied by fatigue, unintended weight loss, or abdominal discomfort, it should not be ignored. Early medical assessment can help identify serious underlying conditions and improve access to timely, effective treatment. 11. Bad breath. Ongoing bad breath that does not improve with proper oral hygiene may signal more than a dental problem, and in some cases can point to serious liver dysfunction, including liver cancer. When the liver loses its ability to properly filter toxins from the blood, certain chemical compounds begin to accumulate. One of these compounds is released through the lungs, producing a distinctive sweet, musty odor. On the breath, a condition medically referred to as fetor hepaticus. Although this sign has been noted in medical literature for centuries, recent clinical research has reinforced its significance. Updated liver disease analyses indicate that abnormal sulfur compound levels in exhaled breath are frequently found in individuals with advanced liver impairment, including malignancies. Some studies suggest that a notable percentage of patients with severe liver disease exhibit measurable changes in breath chemistry before other symptoms become obvious. If persistent, unusual breath odor appears alongside signs such as yellowing of the skin or eyes, chronic fatigue, or abdominal discomfort, it should not be overlooked. Early medical assessment can help identify liver-related conditions sooner and significantly improve treatment outcomes. 12. Night sweats. Repeated episodes of intense night sweats severe enough to soak bedding can be a disturbing experience and may indicate an underlying medical issue, including liver cancer. The liver plays an important role in regulating metabolism and body temperature, and when its function is disrupted by cancer, the body may struggle to maintain stable internal heat levels. This imbalance can lead to sudden spikes in body temperature during sleep, triggering excessive sweating as the body attempts to cool itself. In addition, the immune system's response to cancer can worsen this effect. As immune cells release inflammatory substances to combat abnormal tumor cells, body temperature may rise further, prompting night sweats. Clinical observations have shown that a subset of liver cancer patients report night sweats as one of their earliest systemic symptoms, often appearing alongside unintentional weight loss and reduced appetite. While night sweats can be caused by infections, hormonal changes, or medications, frequent and unexplained episodes should never be ignored. Seeking timely medical evaluation can help rule out serious liver-related conditions and allow for earlier diagnosis and more effective treatment. 13. Bleeding gums and nosebleeds. Frequent nosebleeds or gums that bleed easily are not always caused by brushing too hard or dry air, and can sometimes reflect serious liver dysfunction, including liver cancer. The liver plays a central role in producing clotting factors, specialized proteins that allow the blood to clot properly and stop bleeding. When liver function becomes impaired, the balance of these clotting mechanisms is disrupted, making the body prone to unexpected or excessive bleeding from even minor injuries. Clinical findings from recent hepatology research show that a significant number of patients with advanced liver disease experience abnormal bleeding patterns, including recurrent nosebleeds and gum bleeding. Experts have also noted that standard blood clotting tests may underestimate bleeding risk in liver disease, meaning visible symptoms often appear before lab results become alarming. Liver-related clotting disorders create a fragile imbalance where some individuals bleed too easily, while others paradoxically face an increased risk of blood clots. If bleeding from the gums, nose, or small cuts becomes frequent or difficult to control, it should not be dismissed. Early medical evaluation can help uncover liver-related problems sooner and allow for more effective management. 14. Change in taste. A lasting change in taste perception can be more than a minor annoyance and may point to underlying liver dysfunction, including liver cancer. Many people describe a persistent metallic bitter or unusually flat taste that makes once familiar foods unappealing. This condition, known as dysgeusia, often leads to reduced appetite and inadequate nutrient intake over time. The liver plays a vital role in processing nutrients and clearing metabolic waste, and when cancer interferes with these functions, certain byproducts can accumulate in the bloodstream and affect taste receptors. At the same time, these chemical changes may alter how the brain interprets flavor, signals reducing sensitivity to sweet, salty, and savory tastes. Recent metabolic studies have shown that individuals with cancer-related liver dysfunction often require stronger flavor intensity to perceive taste at normal levels even before treatment begins. These alterations are believed to stem from tumor-driven metabolic imbalances rather than medications. If taste changes persist, practical strategies such as enhancing meals with herbs, varying food textures, and maintaining good oral hygiene may help. However, ongoing taste disturbances should be discussed with a healthcare provider to prevent unintended weight loss and ensure proper nutrition. 15. Persistent fatigue. Constant exhaustion that doesn't improve with rest is not always a result of stress or aging and can be an important warning sign of liver cancer. When the liver becomes impaired, its ability to remove toxins from the bloodstream declines. As these waste products accumulate, they place a heavy burden on the body, leading to ongoing weakness and a deep sense of fatigue that sleep cannot fix. This type of fatigue goes beyond ordinary tiredness. It is a heavy, draining exhaustion that can make routine activities feel physically and mentally overwhelming. Because the liver is essential for regulating metabolism and supporting energy production, any disruption caused by cancer can severely reduce the body's ability to generate and sustain energy throughout the day. More recent clinical observations suggest that a majority of people diagnosed with liver cancer report persistent fatigue as one of their earliest and most disabling symptoms, often appearing before clear physical signs of disease. Physicians note that declining liver function is closely linked to sharp drops in stamina, concentration, and overall vitality. If ongoing fatigue is accompanied by unexplained weight loss, reduced appetite, or vague abdominal discomfort, it should not be ignored. Early medical evaluation can help identify the cause, sooner open the door to more effective treatment, and support recovery of strength and quality of life. Liver cancer rarely announces itself loudly in the early stages. As you've seen, the warning signs are often subtle, easy to overlook, and frequently mistaken for everyday problems. Yet, recognizing these signals early can make a life-changing difference. Awareness is not meant to create fear, but to empower you with knowledge so you can act before it's too late. If any of these symptoms feel familiar or persist without a clear explanation, don't ignore them. Listening to your body and seeking medical advice early could protect your health and even save your life. If you found this information helpful, take a moment to support the channel by subscribing, liking the video, and sharing it with someone who may need to hear this message. Your support helps us continue bringing you trusted, science-backed health information that truly matters.